Hepatitis B core antibody, HBcAb, total. IgM antibody. This test may be ordered as Hepatitis BC Ab, HBcAb, total. It may also be ordered as HBcAb, anti-HBc, HBvcAb, anti-HBvc. Blood specimen is serum. Methods include radioimmunoassay, RIA, and enzyme-linked immunosorbent assay, ELISA. Hepatitis B surface antibody, HBsAb. Hepatitis B antibody, HBeAb. This test may be requested as Hepatitis B surface antibody, HBsAb, Hepatitis BsAb, HBV surface antibody, or anti-HBs. Blood specimen is serum. Methods include radioimmunoassay, RIA, enzyme immunoassay, EIA, immunoradiometric assay, IRMA, and immunoenzymatic assay, IEMA. Hepatitis A antibody, HBeAb. Hepatitis A antibody, HBeAb, IgM antibody. This test may be ordered as Hepatitis A antibody, HBeAb, HAV antibody, or anti-Hep A. Blood specimen is serum. Methods include radioimmunoassay, RIA, enzyme immunoassay, EIA, immunoradiometric assay, IRMA, immunoenzymatic assay, IEMA, and microparticle enzyme immunoassay, MEIA. Antibody, influenza virus. This test may be ordered as flu A or flu B, or influenza A/B antibody titers. It may also be ordered as anti-influenza A/B. Blood specimen is serum. Methods vary with hemagglutination inhibition, high, being preferred for influenza A and complement fixation, CF, for influenza B. Antibody, JC, John Cunningham, virus. This test may be ordered as JCV antibody test. Specimen is serum. Method is enzyme-linked immunosorbent assay, ELISA. Antibody, Legionella. This test may be ordered as Legionella antibody titers or as anti-Legionella. Blood specimen is serum. Methods include immunofluorescent assay, IFA, and enzyme-linked immunosorbent assay, ELISA. Antibody, Leishmania. This test is ordered as Leishmania antibody titers or anti-Leishmania. Blood specimen is serum. Preferred methods are complement fixation, CF, and enzyme-linked immunosorbent assay, ELISA. Antibody, Leptospira. This test may be ordered as Leptospira antibody titers or anti-Leptospira. Blood specimen is serum. Methods include complement fixation, CF, hemagglutination, immunofluorescent assay, IFA, and enzyme-linked immunosorbent assay, ELISA. Antibody, Listeria monocytogenes. This test may be ordered as Listeria antibody titers or anti-Listeria. Blood specimen is serum. Methods include immunofluorescent assay, IFA, and enzyme-linked immunosorbent assay, ELISA. Antibody, lymphocytic choriomeningitis. This test is ordered as LCM or LCMC antibody titers. It may also be ordered as anti-LCM. Blood specimen is serum. Immunofluorescent assay, IFA, direct fluorescent antibody, DFA, and enzyme-linked immunosorbent assay, ELISA, methods are among those employed in identifying antibody response to the specific LCMC. Antibody, mucormycosis. This test may be ordered as Rhizopus antibody titer, Ritzomuker antibody titer, or Cunningham-Ella antibody titer. Blood specimen is serum or finger stick. Literature is unclear, but immunofluorescent assay, IFA, is a common method to detect antibody responses. Antibody, mumps. This test may be ordered as mumps antibody titers or anti-mumps titers. Blood specimen is serum. Preferred methods include enzyme immunoassay, EIA, and virus neutralization test, NT. Antibody, mycoplasma. This test is ordered as mycoplasma antibody titers. It may also be ordered as anti-walking pneumonia, primary atypical pneumonia, PAP, pleuropneumonia-like organism, PPLO, or anti-mycoplasma titers. Blood specimen is serum. Methods include immunofluorescent assay, IFA, complement fixation, CF, and enzyme immunoassay, EIA, and IgM antibody agglutination. Antibody, Neisseria meningitidis. This test is ordered as N meningitidis antibody titers. It may also be ordered as anti-Neisseria meningitidis. Blood specimen is serum. CSF is obtained by spinal puncture that is reported separately. Method is enzyme-linked immunosorbent assay, ELISA. Antibody, nocardia. This test is ordered as nocardia antibody titers. It may also be ordered as anti-nocardia titers. Blood specimen is serum. Method is enzyme-linked immunosorbent assay, ELISA, or Western blot. Antibody, parvovirus. This test may be ordered as parvovirus antibody titers, anti-parvovirus titers, or parvo B19 antibody titers. Blood specimen is serum. Enzyme-linked immunosorbent assay, ELISA, radioimmunoassay, RIA, and Western blot are among methods employed in identifying an antibody response to parvovirus B19. Antibody, Plasmodium, malaria. This test is ordered as malaria antibody titers. Specimen is whole blood. Method is indirect immunofluorescence, IIF. Antibody, protozoa, not elsewhere specified. The specimen is serum. Enzyme-linked immunosorbent assay, ELISA, radioimmunoassay, RIA, complement fixation, Western blot, indirect hemagglutination, IHA, are among the methods employed in identifying an antibody response to the specific protozoa. Antibody, respiratory syncytial virus. This test is ordered as RSV antibody titers. It may also be ordered as anti-respiratory syncytial viral titers, and anti-RSV titers. Blood specimen is serum. Enzyme-linked immunosorbent assay, ELISA, enzyme immunoassay, EIA, and complement fixation, CF, are among methodologies employed in identifying an antibody response. Antibody, rickettsia. This test may also be ordered by the name of the suspected rickettsial pathogen, e.g., Rocky Mountain spotted fever, typhus. Blood specimen is serum. Methods include enzyme-linked immunoassay, ELISA, with indirect fluorescent antibody, IFA, confirmation. Antibody, rotavirus. This test is ordered as rotavirus antibody titer. It may also be ordered as anti-rotavirus titer, adenovirus 40-41 antibody titer, and anti-rotavirus titer. Blood specimen is serum. Enzyme-linked immunosorbent assay, ELISA, and radioimmunoassays, RIA, are among methods employed in identifying antibody response to the specific rotavirus. Antibody, rubella. This test is ordered as rubella antibody titers. It may also be ordered as German measles antibody titers, and anti-rubella titers. Blood specimen is serum. Methods are enzyme-linked immunosorbent assay, ELISA, enzyme immunoassay, EIA, and latex agglutination, LA. Antibody, rubeola. This test is ordered as rubeola antibody titers. It may also be ordered as measles antibody titers, anti-measles titers, and anti-rubeola titers. Blood specimen is serum. Hemagglutination inhibition test, HI, is the preferred method of testing for immune status. Enzyme-linked immunosorbent assay, ELISA, enzyme immunoassay, EIA, complement fixation, CF, and neutralization test, NT, are other methods commonly employed in identifying an antibody response. Antibody, Salmonella. This test is ordered as Salmonella antibody titers. It may also be ordered as anti-Salmonella titers, S-TIFI antibody titers or Salmonella TIFI antibody titers. The specimen is serum. Method is enzyme-linked immunosorbent assay, ELISA. Antibody, severe acute respiratory syndrome coronavirus 2, SARS-CoV-2, coronavirus disease COVID-19. In one method, following dilution in buffer of the plasma or serum sample, a measured portion of the diluted sample and controls are added to a sample plate. After incubation and washing, appropriate IgG and IgM antibodies are added and incubated. It is combined with a substrate, incubated, and read immediately. Antibody, Shigella. This test is ordered as Shigella antibody titers. It may also be ordered as anti-Salmonella titers. Blood specimen is serum. Method is enzyme-linked immunosorbent assay, ELISA. Antibody, tetanus. This test is ordered as tetanus antibody titers. It may also be ordered as anti-tetanus titers, or Clostridium tetani antibody titers. Blood specimen is serum. Titration of tetanus antitoxin neutralization principles is the most common method. Antibody, toxoplasma. Antibody, toxoplasma, IgM. This test is ordered as toxoplasma IgG antibody titers. It may also be ordered as anti-toxoplasma IgG titers, or toxo IgG titers. Blood specimen is serum. Enzyme-linked immunosorbent assay, ELISA, or immunofluorescent assay, IFA, principles may be used for the identification of toxoplasma antibody. Antibody, Treponema pallidum. Blood specimen is serum. Fluorescent antibody, FA, or FTA principles are most commonly employed in identifying an antibody response to the specific syphilis.
Antibody, Trichinella. This test is ordered as Trichinella antibody titers. It may also be ordered as trichinosis antibody titers. Blood specimen is serum. Methods include bentonite flocculation test, BFT, indirect immunofluorescence, IIF, complement fixation, CF, latex agglutination, LA, enzyme immunoassay, EIA, and enzyme-linked immunosorbent assay, ELISA. Antibody, varicella zoster. This test may be requested as VZV antibody titers, chickenpox antibody titers, or herpes zoster antibody titers. Blood specimen is serum. Methods may include enzyme immunoassay, EIA, enzyme-linked immunosorbent assay, ELISA, complement fixation, and fluorescent antibody against membrane antigen, FAMA.
Antibody, West Nile virus, IgM. This code is commonly ordered as WNV IgM. Specimen is cerebrospinal fluid or blood serum. Method used is an antibody capture enzyme-linked immunosorbent assay. Antibody, West Nile virus. Method used is enzyme immunoassay, plaque reduction neutralization, or hemagglutination inhibition. Antibody, virus, not elsewhere specified. This test is ordered as viral antibody titers not elsewhere specified. The specimen is serum. Methods include enzyme-linked immunosorbent assay, ELISA, indirect fluorescent antibody, IFA, and agglutination. Antibody, Yersinia. This test is ordered as Yersinia antibody titers or by species name including Y. enterocollitica antibody and Y. pestis, bubonic plague, antibody. Blood specimen is serum. A common method used is agglutination. Antibody, Zika virus, IgM. The preferred specimen is serum, however, in some instances urine may be used. Methodology is enzyme-linked immunosorbent assay, ELISA, M antibody capture ELISA, MAC ELISA, or polymerase chain reaction, PCR.